Gender Sensitization and Capacity Development Program organized by RCWS in collaboration with UGC. Today we have the eminent academician and renowned sociologist, Professor Sujata Patel. Sujata Patel is Distinguished Professor at Savitribai Phule, Pune University. Earlier, she was National Fellow at the Indian Institute of Advanced Studies, Shimla, and has been a teacher of sociology at the universities of Hyderabad, Pune, and of course, SNDT Women's University too. An historical sensibility and a combination of four perspectives: Marxism, feminism, spatial studies, and post-structuralism influences her work, which covers diverse areas such as modernity, social theory, history of sociology, city formation, social movements, gender construction, reservation, quota politics, and caste and class formations in India. She has been an active interlocutor of teaching and learning practices. She has coordinated a postgraduate online teaching and learning resource of 15 courses in sociology titled ePathshala. She has numerous research papers to her credit. She has authored, edited, and co-edited 13 books and more than 63 peer-reviewed papers. She has been on the editorial and advisory board of various associations and committees. She has been associated in various capacities with the International Sociological Association. She was also the president of Indian Sociological Society from Jan 2016 to December 2017. Welcome, Professor Sujata Patel. For the participants, this lecture will be of 40 minutes, followed by a 10 minutes for question and answers. Over to you, Professor Sujata Patel.
I thank you very much for inviting me to give this lecture. And I would appreciate if the organizers will tell everyone to close their audio. Can you hear me?
Yes, we can.
So if you can ask everyone to close their audios, it would be very good.
A request to all the participants to please put on mute your audios as well as videos while the lecture is on. You can post your question and answers in the chat box which is there. So request all participants once again to mute the audios and the videos. Thank you.
So I'd like to thank RCWS for asking me to present my ideas on sociology. And I want to share the screen, but the host has disabled participant screen sharing. So how can I do it?
Yeah, no.
No, I'll just make you co-host. Just a moment. Yeah. I made you co-host. Now you can share your screen, Professor Sujata.
Where do I?
Yeah, we can see your screen is being shared.
Okay. Do you know how I can put it? How I can put it?
You can do it full screen.
How can I do that?
Yeah.
Yeah.
It's done.
It's done. Okay. So I'm going to talk on risk, trust, and the pandemic. And I'll start by discussing the fact that across the world since the 15th century, we have seen many epidemics. And I want you to keep in mind the 15th century, because 15th century is the time when we see a new system evolving in the world, and that is the system of capitalism. And it's interesting to note that as soon as this new system emerges, we've seen epidemics after epidemics coming up, the most important being the plague. And you must have heard about it because it affected Europe, but it affected Bombay also in the late 19th century. So, and it led to a major crisis in the city of Bombay. Now, because these endemics have occurred, there has been a lot of research done by various social scientists and sociologists and historians on these epidemics. And one of the arguments that they have put forward is that these epidemics represent a crisis. And this crisis allows us to understand the nature of the social order. It makes us assess why it has taken place and what are the risks that it has given to the people who have been affected by it. It has opened up for discussion institutions, relationships, and interactions, and all the taken for granted assumptions of everyday life, and made many people, those who have experienced it and those who are experts on it, ask questions about why, what, how. Now, this COVID-19 pandemic is a pandemic because it's not an epidemic, because most of the epidemics are locality-based or region-based. But for the first time, we have a disaster, disease that has spread across the world. And it is my argument that it has opened up an epistemic window to comprehend both the national and the global dimensions of this health crisis, and allows us to make comparisons of its impact between cities, regions, and countries, but also about the institutions and the relationships and the interactions that constitute the social order and which the pandemic has exposed as well as implicated. So we can make a comparative assessment of each nation state's response to the pandemic and make assessments how they differ and how they are similar, and therefore evaluate differential risks faced by various groups in the world of the global north and the global south. In order to comprehend these risks that have opened up for discussion in India, how to analyze them, I take you through an historical journey. What we knew of the social order in India and what it is today. You know, when India became independent, it was said that a new dawn was heralded. There was a commitment to inclusivity through the principles of democracy, secularism, economic development, and education. However, in the 70s, with the growth of the women's movement, as also that of the Dalits and the Adivasis, this utopia was questioned. And the first critiques emerge about what is the limitations of the project of the nation state. This movement provided a knowledge base to present the problems of increasing poverty and inequality. I can't go ahead if people are keeping their audios open. I don't know what to do. Putul, please. I thought people will keep their audios closed.
Yes, I'm.
Vatsala, please.
Yes, I'm taking care.
Yeah, we are taking.
Don't worry.
Yeah.
Okay, so I go ahead. This movement provided a knowledge base to present the problems of increasing poverty and inequalities, of gender, caste, and tribal exploitation, of discrimination and exclusion, and provided alternatives to build inclusivity. redo the economy, and make institutions democratic. This was the project of the women's movement and feminist politics of the late 70s. Change the laws, bring in policy changes, intervene to create a more inclusive society, because there was still trust in the system and in the leadership. But now, 70 years after independence and 50 years after these movements, we see a new social order in India, which this pandemic has exposed. This presentation is to elaborate what this social order is. What are the reasons for the complete breakdown of this social order? How can we analyze it? And how do I, as a sociologist, suggest we intervene? I start by elaborating why I'm using risk theory to understand this. So what is risk theory and how does it explain to us what is the nature of the present crisis? This theory has been elaborated by the German sociologist Ulrich Beck. And when Beck presented his arguments in mid-80s, and he wrote his first book in German, it was translated 10 years later in English. But Europe at that time, when he wrote this book and was published, was experiencing one of the major disasters, nuclear disasters that took place in Ukraine called the Chernobyl disaster. And his book became very popular, and his theory became reinforced when the tsunami engulfed Japan after the earthquake in March 2011 and flooded the Fukushima nuclear plant and led to radiation and evacuation of people. Both happened because those who designed the nuclear plants, that is scientists and technologists, and those who had to intervene to cope up with these implications of this, the bureaucrats and the political leaders, did not only anticipate the implications, but were not able to stop the deaths and enormous loss to infrastructure and investments that took place. Today, we are seeing the same thing across the globe. Deaths, loss to infrastructure and investments. It's as if the whole global economy and the national economy has become frozen. So risk theory in late 20th century came to be associated with environmental crisis and its impact on the population. However, I would argue that though these two events fitted in with Beck's theories, this theory is more than the environmental risk, though it includes it. Beck argued that the risk theory catalogs and assesses how societal system of modernity engenders and promotes risks to its population. So it's not only about, about environmental risks, it's about the way modernity itself, the new modern system. That's why I said we should think about 15th century when epidemics start across the world. How modernity brings about economically, politically, ecologically, a crisis in society, both globally and within different nation states. Beck has argued that the system that organizes the economic system, capitalism and industrialization, the political system around the nation state, which relates to political parties and ideologies, and the system of experts, technologists and scientists, all are enmeshed in creating and manufacturing risk. So before 15th century, we had risks. It's not that we did not, but these were natural risks. It was not created by human beings. However, today, risk is created by human beings. And the question I wish to address is how we understand this in terms of India. Since the colonial times and then after independence, the nation state has been heavily involved in creating opportunities for growth and development, for organizing the population in trustnet and for social and cultural ties. Thus, I would argue that we should start with understanding the risks in India through an understanding of the state and ask what did it do in the present crisis and what it did not do that allows us to show what is the nature of risk today. So let me start with a particular argument of the lockdown from March to May. As we know, the first case was reported of COVID-19 on 30th January. Between then and March 22nd, nearly 3 months, nothing had except a Janta curfew on a weekend before the lockdown. Politics was as usual. No prior communication to the state and local governments, no communication to the bureaucracy about the emerging health crisis and what kinds of preparedness needs to be done. Wuhan was already under lockdown then, so there was a model available. Now, it is important to remember that China never had a complete lockdown. It only locked down that area which got affected, which was Wuhan. What happened in India was something else. Instead of giving notice, what is this? Why are people intervening in when I'm discussing? Tumhala phone nahi aala to kai nahi?
We're extremely sorry. Vatsala, we have basically muted all the participants, no? Hello, Vatsala?
We have muted all the participants. No one is audible. No one is audible now.
No, just now I also heard some people speaking.
But I can't see it here because I have muted all the participants. I have muted all the participants.
Yeah. Extremely sorry, Sujata. Extremely sorry.
So what we see now is that the most stringent and draconian and complete lockdown of the country's economy was done with only 4 hours notice in India, which has not taken place in this way. The UK also had a lockdown, but it gave quite a good notice. So, and Spain had a country-wide lockdown, but it gave notice. So when there was no communication and then there was no notice, we had a complete panic response due to the lack of communication. What it meant the government will do after 3 weeks and later 6 weeks of the lockdown in terms of the health of the people. There was, of course, as you all know, and we've experienced it, there was sudden closure of transport networks, of production sites and markets and the economy. And the lockdown was announced under the Disaster Management Act of 2005, which was earlier passed by the earlier UPA government because of the tsunami of 2004. This act overturned and took control over other acts and authorities and of the state and districts. What is of importance to see that it was not the health ministry which was governing this act, but it was the home ministry. And it made a health emergency into a political emergency. And so for the first 6 weeks of the lockdown, there was an assertion of bureaucratic command and control. And there was that control hierarchized in terms of governance from center to state, from state to district, from district to the lower bodies. What was communicated as a consequence of this? And perception is very important in this context. What was communicated as a reason for as a consequence of this was that COVID-19 was perceived not as a health emergency, but a threat to public order. And policing was seen a solution to control people who had never ever experienced such a situation. There was a zealous use of crowd control, use of lathi, stakes, arrests, other forms of repression and torture in police custody. And whenever the lockdown has come again and again in various states of the country, even after May, in June, July, and August, it has always meant policing and a problem to and a threat to public order. Now, this is important because it immediately distills all democratic activities. It distills a way to engage with the state. It completely displaces an individual's role in the community, in the larger politics of the nation state, and it completely derides any significance and importance of the individual. So the second point I want to say is there were 4 myths on which this policy was based. The first, that the people of India live in self-enclosed homes. But as we know, isolation is not possible for lower segments of the population who live cheek by jowl in one-room apartments. And thus, in the initial weeks, they came to be policed for any transgression of immobility, and police brutality occurred. And they did it because there was no option to them. And that indicates how much limited an understanding of what are the issues and problems that the state had. Secondly, there was a large part of, there was a myth that the large part of Indians have service jobs, an up-ended service job, and can work from home. In point of fact, most Indians are in the informal sector, between 86 to 94%, and a large number of them in urban India, in small jobs, and are migrants who circulate between villages and cities, and who rotate in time cycles of 6 months to 2 years. They are recruited by labor contractors, rent out single rooms where 4 to 5 stay together, and they have little to no social security. As a consequence, they don't have stakes in cities. All this is something that anthropologists and sociologists who have done work on the informal sector know about. However, this did not come in an assessment from the state. Third, and this is very important because it deals with the way relationships are organized in India. Social distancing was reduced, was used as an equivalent to physical distancing. And it has implications which I'll go into it. And lastly, contact tracing was thought to be done through technology, Arogya Setu, and that would have led to surveillance and privacy concerns. So what I'm suggesting is the first 6 weeks indicated a state which had little to no sensitivity to address the concerns of the largest part of the population that were there, which, as I told to you earlier, though there was a critique of the state in the 70s and 80s about their limited extension and help to the poor, there was an acceptance that the state knew what they were doing because they were interested in development issues. They wanted to engage with the social movements and civil activism that was taking place. Herein, there was nothing of that kind. Not only was a health emergency, which led to the lockdown, allowed for a myth to be created about what are the people, who are the, and what are the people of this country. But it legitimized a Savarna caste's position of how they have to manage, that is, the state has to manage, and the others have to manage themselves. So instead of creating an infrastructure for installing procedures for testing, tracing, isolation, and quarantine, as China set up, and large hospitals within days. For instance, I'm now in Pune, and they set up these hospitals only last week to 2 weeks back. No such efforts were done in that first 6 weeks. And there was a complacency in data and figures of India reaching the peak soon and not having a problem after June. So except for Kerala, which prepared itself earlier, no other state was ready. But even Kerala was not prepared for the second round of infection that it got and is facing the problem now. For the rest of the country, it was disaster. There is, of course, stress in various groups who have differently experienced this pandemic. It has created panic, scare, alarm, fear, uncertainty, helplessness, of not having anyone to mind you and your futures. So what I'm arguing is that the breakdown, the COVID has led to a breakdown of trust and trust networks that have been built since 1947. A trust in the state to look after the welfare of the population. Trust and trust networks in India have always mediated through caste and community affiliations and through gender, given the correspondence between education skills and caste, community, and gender. Thus, the lower the status in society, the lower access to education, skill, jobs, and high incomes. And these processes have created class, caste, and gender inequities. Yet, in spite of these inequalities, I would contend that the nation state and the Constitution of India created faith and belief in redressal of these inequities, in hope for change in status, in ensuring aspirations. This got broken down. And it is important to note that this earlier it had not broken down because the economy had expanded, created opportunities. The state had introduced various policies to ensure inclusion, though these did not reach out to all. However, from 2014 onwards, these trust networks, which were already weak, have become weaker as the economy has contracted. Work participation rate has reduced. Legislation has been introduced to make fundamental changes in what constitutes democracy, secularism, and inclusion in India. Lower segments of society, including the religious minorities, have been isolated. And there has been systematic targeting of secular and democratic practices and those who practice it in the country. There has been, it started with the changes in citizenship law in Assam, later the abrogation of Section 370. I'm just giving examples. Triple Talaq Bill, reservation for economy weaker sections, all this allowed for actually the reinforcement of an idea that the larger population is now outside the realm of the state. You will note that many of the ministers have said that they are no longer involved in governance, that they have to only do government. So let me ask, what is trust? In one way, it is the opposite of risk. Trust is not only about people with whom we share the home or family, it is about people with whom we share everyday relationship. And I accept, and I mentioned it earlier, that these relationships are unequal. And it is therefore within the family and outside it, it's trust is bound with relationships which are unequal. But it is also about neighbors from whom we trust we can confidently borrow sugar. It's with bus conductors who give tickets during travel in public transport, at tailors who make our clothes, or the corner shop when we get our mobiles repaired, or electricians and plumbers who repair our fridges and our chokes up, or our maids who will clean our homes in institutions such as schools and colleges, in exchange of goods and services, and on social media. These relationships, as I said, are unequal, but it is of reciprocity and of exchange. Trust reinforces mutuality and reciprocity. It is having confidence in this mutuality and in possibilities of creating new relationships. It allows questioning of unequal and violent relationships in the abstract propositions that structure reciprocity as it is acceptable by the state, that there is a possibility of redress, of opportunity, and for aspirations. Believing in these abstractions is extremely important for continuity of our lives and for being humans. It helps us to create positive emotions and concerns for each other. The nation state and its constitution has created mutuality and belief in these abstractions of rights in democracy, and thus these norms. And therefore, it is also by extension a belief and faith in our humanity, in our myriad social relationships, even though they are unequal, and in the societal system. So today what we see is there's an increase in hate crimes, in social media trolling, targeting of protesters, those who question policies of the government. And there is therefore an increasing feeling of disillusion. People are asking the question, can we access healthcare and employment? Can we plan for the future? Or do we have to live in terms of day to day? Risks regarding health system has particularly increased for all, and more so for the poor, but also the old and those who have other illnesses. Most of them finding it difficult to access it. And I just give some data that since COVID started and almost all hospitals went into COVID-related healthcare, immunization of children have dropped by 27%. Institutional deliveries have dropped by 28%. Major surgeries fell by 60%. Outpatient treatment for heart ailments, cancer, by 70%. And 51% fewer cardiac emergencies were logged in. This is the Department of Health data of the central government. And there are further data on TB, diabetes, asthma, screening of babies for birth defects. We have created in these 5 months a new population which has no health immunity. Why? Another issue relates to official statistics on COVID infections. Another point of distrust today. And even though tests have increased, in 1 month, it was 35 last month, it was 35 tests per 1,000. And now on the 9th of September, it is 0.77 tests per 1,000. But you look at the comparable US data, 2.22 per 1,000. And around us more and more, with people becoming ill, and we are 1.13 billion, it seems that the government has given up. There is, of course, as a consequence, an uneven nature of governance of the pandemic. For example, the best governance was in Kerala, and the least governance has been in UP and Bihar. And people are migrating to other states and cities to get access to health. because they are not getting it in their own cities and own regions. And there is a huge role of big pharma, and there is an unequal public health infrastructure. There's a lack of human resources. India has 0.7 doctors per thousand when the global average should be 1.72 per thousand. There's lack of medical equipment. At least in Pune newspapers, we have seen for the last 3 to 4 days a discussion that there's no ventilators, no oxygen cylinders, and there has been very little export of them through the states. And there is, of course, because all this is related to decreasing public health budgets. Government has spent only 11.3% of the GDP on health. And most of the time, everyone spends their own money. And this has led to mental health problems. And, as we know, these data is before COVID. 1/3 of world suicide is in India, and 1/4 of male suicides are in India. And now it's much more. And the happiness indication suggests that India is one of the lowest. And Pakistan and Nepal are much better off in terms of happiness, which is related to social support, levels of generosity, economic strength. So what happened in this 3 to 4 months, and now 5 months, and we are going into the 6th month? We have seen cycles of decrease, increase, decrease, increase, and regional spread. And that has been because not only the government did not upgrade the health structure, but because the way it had the lockdown, it broke the back of the economy. And today, the latest figures given last week was, we are in the minus, sorry, this is a wrong figure. We are in the minus 23.9% GDP. It's minus, just not positive. One of the highest across the world. Already the economy is in, and even before COVID, the economy was in problem with work participation rate having fallen since 2016, mainly affecting the informal sector and particularly women. But after the COVID, salary jobs have also fell from 86.1 million to today 67.2 million. You look at the deep decrease. Thus the question is the government's policy for revival relevant? Which groups does it cater to? Were these old programs with new names? We now know, as a consequence of the pandemic and the protests that brought the migrants in urban areas onto the streets of the cities, that actually half of the city's informal sector, about 1/3 to half of them are unorganized labor, who are part of short-term circulatory migrants. They live in rented housing in slums or in office spaces, do not have social security, nor rights to access these, nor protection from labor contractors, who have recruited them. Their migration back to their villages have informed us about the organic interconnections between villages and cities, and raised the problem regarding what would happen as a consequence to these villages who live on their remittances and who now have been infected by those who have migrated there. Have a little to no targeted policies for them, except the fact that they are using NREGA to have incomes for every day so they can survive. But what about the social security and rights interventions to support these migrants in urban India? Just recently, Jadres has asked, why can't we have public works in cities? Because cities need to upgrade themselves. Certainly, Bombay needs to upgrade itself. Can we not have a similar scheme to NREGA in cities of India? And of course, particular importance has been the impact of all this on women workers, whose work has decreased significantly before the onset of the pandemic. But unfortunately, we don't have very detailed data on this matter. So the lockdown has created stress, and with growing unemployment and lack of health and support of individuals, there has been, of course, an increase in suicides. Vulnerability has increased for children and adolescents, single women and old women. Breakdown of trust has led to an increase in interpersonal violence, particularly domestic violence, trafficking of women and children, withdrawal of the latter from schools and colleges. But most important, the trust in state institutions has broken down. It has led to hate crimes in social media, and it has led to interventions and lynchings. I have elaborated, and I would like to conclude now. I have elaborated how the withdrawal of the state from governance for the people has raised precarity, insecurity, and risk for them. But we need to comprehend why we have reached this situation. And therefore, I would like to ask 2 or 3 questions. Till the 70s and 80s, as I said before, there was a confidence that the state was having an engagement, communication, interrelationship with those who have been deprived of being part of development. Since then, we have had neoliberal policies which have decreased budgets and promoted privatization. Is this the reason for what we are seeing today? Much more larger is the question, has the government abandoned the people? Why are there so many infected and so many deaths and complete breakdown of administrative processes that can help the people? What has happened to the administrative culture for which India was so famous for? Can India, which is such an unequal country, afford to have a government to withdraw from care of its population? Such a situation is in all countries. But wherever there has been a strong health system and strong governance, the situation has improved. So the pandemic opens up an assessment of the social order, both in India and across the world. This is how a sociologist would understand it, and this is how I understand it. But I do think that I can conclude by saying that this kind of analysis also provides us with a way to think of the future and how we can individually act for it. That is why risk theory is very important, because it talks about its opposite, trust. I think individually we have to build trust, because it's through trust that new solidarities are forged. Of course, these solidarities which we inherited earlier are breaking or have broken. But there is a need to think of an alternative through new forms of trust networks. This is the challenge we have, and I hope all of you will help to expand these trust networks wherever possible, so that if the state can abandon us, we don't abandon each other. Thank you.
Thank you so much, Professor Sujata Patel, for bringing in the relationship or the dynamics between trust, risk, and the role of the state. I have one question. With the collapse of the health system, the inequalities which are already felt, and capitalism is already on the rise, and failure of the state machinery, with large unemployment rates, business failing, and all sections of the society getting impacted, do you think that we are actually towards a situation like a civil war-like situation? That is the first. And second thing, do you think that civil societies should be working all the more hard so that that we come out of this situation? Because state machinery, we know, is lacking.
Are you going to take all the questions together, or can I answer this?
I think you can answer this.
Answer this one, yeah.
Yeah.
Can you hear me?
Yeah.
So I ended up this presentation with a plea that we need to build solidarities through trust networks. You know, all of us are involved in various trust networks in our schools, in our colleges, in our institutions, as well as through our where we stay and where we get ourselves integrated with the larger economy through the transport, through various other activities that we do. We really don't need to abandon this, and it's very important we remember that. Because what the government did was to isolate us and therefore break all these relationships. And if we keep these relationships, we are going to ensure that employment and the economic activities continue, but social and cultural activities also continue. And because we recognize that these are caste and gendered oriented relationships, it's important to start thinking of what it would be without that caste and gendered relationships. I do not think that only civil society organizations can do it. I think it's important for every individual to intervene to do it. Then only the civil society organizations can help to promote it in much more institutionalized way. So I do think that we should think in new ways to both individually and collectively reorganize ourselves and take an opportunity to break the earlier unequal relationships in which we have been always involved in, and to think of how we can create more inclusive relationships in our interactions with all the activities that we do.
Thank you so much. We have a second question from Shafi. Wants to know, can you please tell us where do you place the role played by the citizens who distributed rations, helped migrants, or at least made some arrangements to ease someone else's life? Does the role of citizen count anywhere in the process of trust building, especially when trust and trust networks have been broken down due to the negligence of the state? I think that's similar to the first question.
Yeah, and it's, you know, when I talked about in the beginning of the nation state and the constitution and the trust networks related to abstractions in the constitution and the belief in the constitution, it was about citizenship. Constitution describes our roles as citizens, and therefore all the activities that have been intervening in the welfare of the people are activities that we do as citizens, and therefore affirm that citizenship. And that's exactly what I've been saying.
Thank you. We have third question from Megha, and she wants to know, when migrant workers who are returning to their villages and hometowns, and they may have spread the diseases, so was the lockdown really necessary to stop this pandemic, even though it is still spreading like wildfire. As we all know that because of the lockdown, migrants and marginalized people are the ones who were affected. So what other measures do you suggest? This is from Megha.
There seems to be two issues here which needs to be separated. If you look at the start of the pandemic, which occurs from January, it came through international travel. And this international travel was made by those who had gone for work or personal reasons, and therefore they came from the upper sections of the society. If they would have been quarantined then and there, we would not have had the problems that we had later. However, what happened is that the spread actually occurred before the lockdown really happened. And this is not I saying it. A lot of people, epidemiologists, have also said that. Secondly, there was no effort to build up the health infrastructure during that 6 weeks when we first went into the lockdown. And when we went into the lockdown, if we would have given time to the people to migrate back to the village and would have informed them that there will be a problem of jobs and employment, and that there has to be access to such employment in the rural areas created before they went back, we would not have seen so much spread in the lower classes of the society, which happened in June, July, and then into the various arenas when they went back into the so-called rural areas, where most of the migrants come, as you know, from UP, Bihar, Madhya Pradesh, and West Bengal. And we wouldn't have seen this. But I want to emphasize here that this spread, you can't control it. It has to be people who can control it. It's not as if this is something that any government can do without involving the people in ensuring that it happens. It's people who have to be told how they can keep themselves outside as much as do preventive health rather than curative health. And that is the communication which did not take place and still is not taking place.
We have next question from Dr. Vatsala Shukla. She's asking, these new ways should include degrowth movement as well. What do you think about it? And what do you think can be the way forward?
What do you mean by degrowth?
Vatsala, do you want to elaborate on this point?
Yeah. So basically, degrowth movement, which is, against these kind of precarious, capitalist kind of development, which is growth-oriented, materialistic, consumption-oriented. And it also takes about, when we talk about sustainable development, when we talk about that environment-friendly, eco-friendly, that which is very much rooted in eco-feminist kind of development. So this is in that larger framework that degrowth can be seen, and how it can be, if at all, when we talk about new movements or new ways of thinking or comments. So I just wanted that.
I would rather talk about it as sustainability, as development through sustainable means. And I use sustainability not in terms of the millennium sustainable objectives that the UN has put, but in a much more larger ecologically sound way. And I think there have been many many alternative ways of having sustainable agriculture, sustainable growth. And I think there has been very little engagement with that in by the state earlier also, and of course not today. So because sustainability is a larger theme rather than growth. Growth is very economic, but sustainability is also about individuals, how they live with each other, and how they can bring in generosity and therefore happiness for themselves. So I would prefer to use the word sustainability.
Thank you. Can we move to the next question? How does, this question is from Aparna, and she wants to know, how does one deal with this break of trust and yet function in a society that is now understanding or undergoing the post-adverse effects of the pandemic and the economy? So what are the immediate measures that you suggest?
I've already answered it. Yeah.
No, this question is regarding domestic violence. Let's see if the rise. So Abhinav wants to know, there is a rise of domestic violence and it is disturbing and has reached a permanent high. And what can be done about this?
You know, these are very specific questions on which feminist activism has intervened. And just recently, I don't know if all of you are in Mumbai, but I just got a message from Akshara that they are putting together various apps for people to access, and so that others can intervene to help them whenever there's violence. This needs to be done, and there's a long history of such interventions made by women's groups, and they continue to do so. So I don't think I can answer this more than this.
Thank you so much, Professor Sujata Patel, really for this engaging debate and conversations that we had.
Sangeeta,
I don't, I cannot
Sangeeta,
see. Yes.
Yes, Sangeeta, there's some problem with my laptop. So, so in fact, I'm not able to type the question in the chat box. But then, of course, in fact, I would like to know from Professor Patel. You know, I mean, in the context of your breaking trust and the need to build a new solidarities, I would like to know, what do you think about this, a new narrative of vaccine, this nationalism which is coming up, which I think in a huge manner will perhaps really affect the world. I mean the world order, because on one hand there's a need that nations trust each other, nations learn to trust each other, and at the same time we can also see the greed, the need to have a new vaccine, especially what happened with the Russian vaccine and the way it is happening, and this new term which has been coined as vaccine this nationalism. So I would just like to know your views on that.
Well, United States has already decided months back that it would use the vaccine for itself.
Yes.
And then WHO set up a group to ensure that the vaccine is distributed equally. And they're interested in ensuring that. I think it's going to happen.
Mm-hmm.
And it is negative nationalism.
Right, yeah.
But it is also not about between nation states. It's about between who will get it in India also.
Yes.
And right now they're saying health workers will get it.
Yeah.
But they would be the first group. But what about this? You know, we've seen, what I'm trying to say is that between 80 and 90% of India's population was thrown out from the state ways of thinking of policy, whether this will happen again with the vaccine. Because we don't have them on our registers. We don't know who they are. They're constantly migrating. We don't even have ways in which, they did give some money to people who were migrants, and we know how many it has reached, because a large number of them don't have accounts, bank accounts. They work with cash, and they were the most affected when demonetization took place. And so I don't know what to say here. It is not about, for me, nationalism. It's that India has got 3 to 4 trials being done. And in these 3 or 4 trials, who will get what? And how? I'm asking this question because please remember the data I gave you about immunization. 26% of people are not being given vaccines which are necessary, like TB, like smallpox. I hope we understand this. So already the poor have less access to the everyday vaccines. So what about the new vaccine?
Yeah.
In fact, it seems to me that there's no care for people to die or people not to live. And that is the worst thing that has happened today,
Yeah. Thank you. So Sangeeta,
there are no relevant questions now which we.
I know. In fact, I saw some of the questions. Yeah.
So we have taken up all the relevant questions. So I think I would now request Dr. Putul to please say a word of thanks.
Yeah. So I think I'll just put on my video and see whether it works or not. I don't know. No, there's some problem with my laptop. No, luckily it functions. Yeah.
We can see.
Yeah, I know, but there's some problem with my laptop. I can sense that. Anyway, so finally we come to the end of this session, and on behalf of the Research Center for Women's Studies, heartfelt thanks to Professor Patel for having accepted our invitation and for a very wonderful talk. In fact, I have really heard many. Who is this? Vatsala? Who is this? Hello. Vatsala, who is this? I really don't understand.
I have muted.
I'm really sorry. Hello, yeah. So on behalf of the center, I thank Professor Patel and for a very strong, powerful talk. In fact, I mean, my point is that I have heard many webinars, but frankly speaking, nobody has really made an attempt to link it to the larger emerging social order, which is so important. And the very important point, which of course is there with me, that the pandemic has opened up and this epistemic window. I think that's a very important point for us. So on this note, we come to the end of this session, and I thank all the participants also, and I hope to see everybody for the remaining lectures also. Thank you everybody.
Thank you very much.
Thank you.